For this video, I'm going to show you a neck massage. I'm combining what I teach at level 3 and level 4 in the courses. So we're going to be in a supine position. It's really nice as well at the end of this to turn the client over and then really get the head in the face hole here and work on the back of the neck and work all around the traps. But for this video only, we're just going to keep them here, and we'll probably be spending maybe 10 minutes or so on the neck, the sternocleidomastoid and the scalenes and some of the traps as well. So the first thing I do, make sure my client's comfortable and warm and draped. We're only working at the top here, so if it's winter, cover them right up to this point, keep them nice and warm. First thing I'm going to do is just have a little feel of their range of movement. So what I'm going to do is I want to be in control of this. So that's it, nice and relaxed. I'm going to turn their head, rotate their head to the left, and just have a little feel of how far they're going. Now 80 degrees, if that's 0 and that's 90, 80 is fairly normal. Okay, so that's pretty good. You can see that muscle there popping out, the sternocleidomastoid. Let's go the other way. And that does feel tighter. I don't know if it's obvious to you, but that range is not as good. So with that movement, rotation to the right, we've got some tightness, so we could have some traps on this side. It might be the sternocleidomastoid on this side, which is the one that's on stretch. So that's giving me some ideas of where I want to work. So I'm going to start off with the traction. Now what I can do is hold the bottom of the occipital bone here, hold the head firm, and then pull this way. So I'm just leaning backwards, just getting a bit of traction in the neck joint. Now I would do this before I put any lotion on, and my client has already just had a chest massage, so I can feel some slip going, but if you can do that before any lotion is put on at all. If you find you're not getting enough pull, just lift your head up for me, that's it, perfect. We can use a technique where we go here, we support the head, we can put hand, if they're okay with that, under the chin, and now we've got a little bit more leverage, so from here I'm going to pull towards me. So the traction will go into the neck. They might feel it in between the shoulder blades. They might even feel it in their lumbar area. So it picks out the tight bit. So do that before you put any lotion on. It's quite a nice assessment at the start of the treatment. You can do a whole neck massage without any lotion or oil at all, but I think it's quite nice to just use a tiny amount. So today I'm using Naki Sports Massage Lotion, and that is probably going to be enough for the whole treatment today. Just apply a little bit around there. So the first thing I'm going to do is just some circular movements around the back of the neck. Now the neck is quite complicated in terms of the muscles around this area, but you need to have a look at the other videos. So I've got some bony landmarks and muscles in the neck that will help improve your knowledge of this area, but I will talk about them as well while we're working on it. So just getting the blood flowing a little bit, getting that area warmed up. Okay, so I'm going to start off with a little technique which is frictions. I will do that, I'll reinforce a finger, and if you can zoom in here just to see what I'm doing. I'm going to start there and I'm going to just friction side to side, and I keep going until I go right underneath to the back, and I'm doing that on both sides. So until my fingers come together at the middle, which is near the spinous processes, and then I'm going to come back out. So they're really little friction techniques, side to side or transverse friction techniques, but it does use quite a lot of pressure, and even by doing this we're working on top of the traps and the suboccipitalis muscles. As clients will they may comment that it does feel quite tender, or as you're working on these areas as well, they are full of trigger points. So just by doing this, they might feel it up here in the temporals, they might feel it into their eye. So the referral pain for these areas, you will get a variety of locations. So don't know if you can feel anything on the couch at the moment as I'm doing this. Got any referrals anywhere? No?
No, just a bit tender.
Just a bit tender, okay. So small little friction techniques, side to side, and we can change that to up and down friction techniques, like so. So it just changes the angle slightly. It will feel a little bit different, but really it's the same technique. Okay, and coming out to this bony bit just behind the ears called the mastoid process. And we will mention that again in a bit. Okay, so now we're going to change what we're doing. I'm going to work down the back of the neck. So from here, just come in and have a look if we can. I'm going to be working down this way to the base of the neck to about C7 and up. But I'm going to be doing that in really small friction techniques like before, but instead of working along the occipital bone, I'm working down the neck, and I'm doing that with both hands either side of the neck. So I can start with little friction techniques, longitudinal ones this way, get to the bottom, and then I can come back up using transverse strokes. So it's all really intricate, small techniques, but you will feel it. It's actually one of my favourite treatments to have done, because the neck holds a lot of tension, whether you're stressed or you've got poor posture or whatever reason, simply the reason that your head weighs about 5 kilograms and your neck is having to hold that up all day long, apart from in this position where it's relaxed. So these muscles do work hard. So we're going up and down movements, right down to about C7. C7 is the 7th cervical vertebra before it changes to thoracic. Okay, coming back up, I'm going to change it now. I'm going to go across, so I'm doing transverse frictions across these muscles. Okay, and then let's see that off a little bit, circular movements with your fingers or your thumbs. Okay, from here, I'm going to turn my client's head. So I did find, using the rotation earlier, that the right sternocleidomastoid was a bit tighter. So I'm just going to turn the client's head this way. That puts that muscle into a shortened position. You will find some clients can't relax at all. And if that's the case, like, try and hold your head up for me. There we go. If you see a sternocleidomastoid like that sticking out, you know the client's not relaxed. Shouting relax at a client will not make them relax. So let's do that again for me. Let's pretend you can't relax. And if I tap it a few times, it kind of links it to the brain, and it actually, they're more easier to control that muscle. So relax for me now. That's it, good. And so you will see it kind of melt away. There we go, look how soft that is. It's really hard to work on a muscle that's tense. So from this position, I'm going to work from this mastoid process. Sternocleidomastoid attaches to sternum and the clavicle about here, and it comes up. It's quite a broad muscle, and it comes up to a smaller point on the mastoid process. So I'm going to start with a few frictions here, just behind the ear, working on the tendon of that muscle. That's it. And then I'm going to work down the neck this way. So I can use knuckles, thumb, fingers. So you choose what you want to use. I try and avoid thumbs wherever possible, but however, there are some locations that it is a bit easier, and there isn't a lot of pressure going through my thumb joint at this point. So just be clever about what you use and when. Okay, if I was to press too much pressure down there, I'm going to be getting the trachea and the voice box, and it will all become a little bit uncomfortable. You can see the Adam's apple here as well. So definitely we're not working in front of that. As long as we're on it or anywhere behind, it's a safe technique to use. But we don't want that pressure down into the neck. We want it down the length of the body this way. There is something else you can do to actually pick the sternocleidomastoid up, or the SCM up. And because of the lotion, I'm not sure if it will slip or not, so we'll have a go. But if you lift your head up for me again. Okay, so I've got the sternocleidomastoid there. You see that? And relax. Okay, so we try and get that in a grip, in a bit of a pincer grip. I think my lotion, I'll get it a little bit. Okay, so you might be able to kind of pick it up off the neck rather than pressing down into it, rather than a pressure stroke. If you want to have a go, you can use a couch tissue and wipe some of the lotion off. But just showing you, it is a technique you can do, and we can see, look at that erythema already. So definitely warming it up. Okay, what sits then behind the sternocleidomastoid. So sternocleidomastoid is that wide muscle. If I come to here, there's a muscle called the anterior scalene. The anterior scalene sits just behind that sternocleidomastoid. So with my very short nails, if I go like this and I get my client to relax, there we go, just nice and relaxed, I should be able to get underneath the sternocleidomastoid and kind of hook round and get into the anterior scalene. Now it might feel quite sensitive, this, but clients do come in with neural symptoms into their arm. So if my client now came into the treatment and said he was getting pain in his fingers or down his forearm, I automatically think the brachial plexus, and the brachial plexus comes up through this space here under the clavicle. It's called the subclavian triangle here, and tightness with these deep scalene muscles can cause those neural symptoms. So don't just think those tingling fingers are a carpal tunnel or a hand issue. It's probably stemming from the neck. I'd say in most cases it is. So anterior scalene connects onto rib 1. Rib 1 is underneath the clavicle here, and it's going up to C6, 5, 4, 3. So it's those insertions here. If I come out about an inch or about 2 centimeters under the clavicle, so I'm coming out a bit further, I would be on the middle scalene just here. So I might put some pressure on the middle scalene. Middle scalene is also rib number 1. Okay, a little bit of pressure. Could do the pressure with my fingers as well. I can do some frictions on it. And then I'm going to follow the line of the middle scalene again up the neck here. So middle scalene is C6 to C2. I won't be able to get to the bottom of it, but I'll definitely be able to get to this top section up the top here. And C2 is the highest of the scalene attachments. Okay, so it'd be the posterior transverse processes in the neck just here. If I come out 1 more inch, so I've gone anterior scalene, I've gone middle scalene, I'm going to go out to the very end here, and I can feel the end of the clavicle. If I was to press in there, I would be pressing in the location of the second rib. So posterior scalene, the second rib, and it's a shorter attachment, so it's C6, C7. Okay, but it's going to go this way. Follow that line there. So if I can get my thumb or I can get my fingers and just work a little bit further out. You don't really want to do a technique that is so specific on the scalenes, because all these techniques are going to be getting bits of all of them really, but it's just trying to ease them all up and trying to loosen it so that if there is tightness causing pain going down the arm, all these techniques can be really beneficial. So we've got sternocleidomastoid and the 3 scalenes. I'll put my client's head back this way. Okay, so that was just one side of the neck. I'd repeat exactly the same on this side of the neck. For the video, you're only getting 1/2 of a neck. So you need to either re-watch that first bit or try with your memory to see what you can do on the other side. But I am going to show you a few stretches as well. Remember, after any deep work, it is always nice to have a soothing technique as well. But when we're working on the neck, I think we get so thinking of what our fingers are doing, we forget what the palms are doing. I've seen people work on the neck like this, and client ends up getting a facial and then they go away with lotion everywhere. So just make sure that all your techniques are on the muscles themselves this way. So I'm going to show you a few stretches. Well, in fact, what I'm going to do is I'm going to pick my client's restriction and show you an MET for that restriction. So where did he have a restriction when I first noticed? That way was good. That way, still restricted. Can you see that? So we're doing right rotation. So using an MET technique, which is part of the level 4 course, it's taking them to that end range, which I would say that is his end range. And with the head, just be extra careful as well. So what I'm going to do is hold his head in that position, and I will say lightly, if you can try and turn your head round, but I'm going to stop that movement. So it's now an isometric stretch, and maybe 10, maximum of 20%. Okay, so from there, try and turn your head round into my hand. Perfect, that's good. And just keep going with that amount of pressure. but I don't want any movement occurring. So that's an isometric contraction. That's good. I'm going to do that for a full 10 seconds. 9, 10, relax. Take him a little bit further. Okay, so there was a little bit of movement there. Hold that new position for 10 seconds. Okay, so we're both relaxed. I'm probably slightly more relaxed than my client, but holding that new. So the new range now, I'm going to get my client to try and rotate back into my hand. 10 seconds. That's good. I can feel the pressure, but it's not excessive at all. We don't want a client to be pressing 50%. They'll end up injuring, they'll end up hurting their neck or pulling something. Okay, and we're here to make them better. So 9, 10, relax. Good. We're seeing the neck muscles. There we go. Look at that movement. That's good. So that's my third position. That's the last position I'm going to use. I'm going to hold that for 10. And while I'm talking, it goes pretty quick. In a session, yeah, your timing will be a bit more accurate probably. You have time to think about it. And last one, I want you to press back into my hand. Lovely, good. I can feel the pressure. Good. 6, 7, 8, 9, 10, and relax. Brilliant. That last position, I'm just going to hold there. Okay, like a full MET technique, you'd hold that last position for 30 seconds. Now, would I do both sides? Well, my client's range was pretty good to the left and not so much with the right. So I like working with restrictions to try and balance. So possibly not on this client. Okay, and just get them to relax. I might finish with a little bit of traction. I'll talk about finishing techniques, but this would lead me nicely into a back massage. So this might not be the end for my client. I might continue and do 40 minutes on the posterior surface. But for the video, if I'm just finishing this technique here, I'd want to just hold the neck in that position or do something that I call a cradle, which does feel nice and relaxing. Okay, and you can hold that for 10-15 seconds. And then put the client's head down and relax there. And that'll be the end of the neck massage.